my people who are live today as we continue with our talks, our medical talks of the day. We usually go talk about medical stuff here, advise mental health issues, and many issues that are concerning the society, So today it's a good day, and we have learned so many things about Smiler in the City. Afternoon, Dr. Benjamin. Afternoon, Smiler in the City. Afternoon. Now, we have learned so many things about the heart, how it coordinates itself, how it goes around and works on. Let's see, this one, how it goes around and makes things happen. You understand? Okay, this one I'll delete it. So the heart, we have been having a week of the heart edition, and after we have diagnosed someone, after this person has been stabilized in hospital, you know what happens next? Treatment. Now to give the definitive treatment to this person, and there are some things that we give. There are some things we do to this patient so that we can treat this patient effectively. You cannot diagnose a person and leave this person without treatment. You see, this person needs effective treatment. So heart conditions, as you've seen, most of them are congenital. Most of them, people are born with them. Some people are born with heart conditions, and some people are also acquire them in life. The most important thing in life when it comes to heart condition is your day-to-day things that you do. How do you take care of yourself? How do you take care of yourself when it comes to managing the conditions that you are facing? How is your lifestyle? As we have talked so many things about the heart, you have seen it is bringing up so many issues when it comes to the conditions that are affecting the heart. It is bringing up so many issues. You saw there was diabetes. We came up with atherosclerosis. Those are complications of the heart. As you log in, if you are new in the house, greetings Barbara, I can see you, Smiler in the City. If you are new in the house, please subscribe. If you have any question that is medical, please put it up so that we can discuss. Don't forget to dial that like as we continue with the talk. So today we are going to learn about treatment of heart conditions. But the most important thing that I'm saying, before even we treat these heart conditions, the most important thing comes on your lifestyle. If you are not born with these conditions, the most important thing is your lifestyle. Lifestyle is very important when it comes to heart condition. We have discussed so many things that comes in, and you have discussed so many things that are related to heart conditions and how you can help yourself. You know, when you are young and you are not born with a condition, you may not know its impact. And you know, when it comes to lifestyle diseases like diabetes, heart conditions, you grow as you progress slowly to the conditions. So you don't appreciate it at early stages. So at early stages, what you usually do is you usually give yourself time. Do the bad habits that you really do. People take alcohol, people smoke cigarettes, people do all kinds of things when it's an early stage, not knowing they are piling up to somewhere where they'll have to regret. So as we speak right now, my advice to everyone who is watching and everyone who is here listening, it is important, and it's very important when we are talking about treatment of heart conditions. The first step in treatment is to avoid. The first step in treatment is to avoid. So the important thing when it comes to taking care of yourself, you know, you've seen these comorbidity issues. They start from 29, the ages of 29 heading to 30. So guys, when you are coming in right now, this is Dr. Benjamin giving health advice. So guys, like button is there. Hit that like button. If you are new watching, don't fail to subscribe. Don't fail to subscribe. Sometimes we come so many, we are a community and we discuss issues that can help anyone. I can see Sha Travels in the house. Thank you so much. Okwemba is here. Okwemba, my namesake. Greetings stamp from Florida, Ben, and chat everyone. So if you're coming in, please don't fail to hit the like button. Before we continue on how to treat, good afternoon, Benjamin. Good afternoon, Okwemba, my namesake. I'm cool. I know you're cool too, wherever you are, and you're doing good. As we continue, please hit the like button. If you have any random question that you think is medical, don't fail to ask that question, because it's a very important question that we will discuss and you may find help, or someone else in the group who was not ready to ask it can find help too. So King Ray is here. Judy, thank you so much to be in the house. Today we are dealing with how to treat heart conditions. Hit the like and subscribe button. So important so that we can get more impressions coming and coming and coming and coming. Hey, my supporters today are here in full swing, and I like it when they are here and they are watching and we are discussing and we are doing good and progressing on well. Big up everyone in the chat. I know there are so many people watching right now, and don't keep quiet. Do something in the chat. Do something. Ask a question. Interact with the people that you're seeing in the chat, and we move on and we move on and we create a bigger society. Now, let's continue, my friends. Let's continue, my friends. You see, my advice when it comes to heart conditions is don't wait until you are above 35 to start taking care of your heart. You get? It is a good step to start to advise the younger generation, people that are between their 20s, to know the effects of living a sedentary lifestyle and taking bad habits, because the repercussion comes at above 40 years. You check it out. The repercussions come above 40 years. So it is important that if in your community or in your family line you have seen someone has hypertension, or you have seen someone is having diabetes, you should start thinking about yourself. And you as a grown-up person, as a mature person that you've gone through the process, start advising. You've seen so many diseases that are coming because of free radicals. I usually talk about free radicals. I know everyone in the room knows now about free radicals. Free radicals are things that are provided after most of the free radicals come from deep fried foods, because of the fats that are deep fried. But they are the ones which do the most bad thing of oxidative states of the cells. They make cells to mutate and damage. Can you tell me what effect coffee has on your heart or overall? Yes, coffee is a stimulant. So stimulants, what do? Stimulants, they excite adrenaline. So when adrenaline is excited, this is for Sha Travels. When adrenaline is excited, what happens? Your heart beats faster. You get tachycardia. So coffee excites your heart muscles to beat faster. Can you tell me what effect coffee can on your heart muscles or overall? So that is how the coffee works. Coffee is a stimulant. So that is the work of coffee. You get it? So when you take coffee, you expect your adrenaline to come out. So when it is coming out, your sympathetic nervous system. Sorry, I was on the wrong one, waiting for Dr. Ben. No worries, Jamaican uncle. It's morning. Good morning from the US. Good morning, Jamaican uncle. Sha Travels. Today I woke you up. I was in your life. So drinking coffee can get you a heart attack. No, the body knows how to balance Sha Travels. So don't say it can get you a heart attack unless you have been told by your doctor not to take. I am Naliaho. I am Naliaho is in the house. I am Naliaho. Welcome. Hit the like button if you have not hit. If you are a new person today, just know you are looking at Benjamin, the wise guy, or Doc himself, Ben. You are seeing Dr. Ben. Subscribe if you've not subscribed. We have been talking. I did not say that, doctor. Oh, okay. Sha Travels. Okay. Uncle, good morning. Now, we have been talking about heart conditions. I've told people about how heart conditions come. I've told people everything about heart conditions, and we have divided them into two: congenital heart problems that children are born with, and the other ones that we acquire as we are grown-ups, the other ones. Yeah? And you have seen for yourself, most of the other ones don't come by themselves. Most of the other conditions, they come because of sedentary lifestyle and actions against ourselves. That one is not me saying, you have seen it for yourself, and now it's time to reorganize ourselves and teach everyone in the society that heart conditions are, most of them is us ourselves that bring for ourselves, but it is so gradual that you may not realize. You get it? It is so gradual that you may not realize that you are bringing something for yourself. You get it? Now, importance of treatment of heart condition is to keep life going on, and that is what we are gonna do today. So keep in touch, keep it large, because we are going to learn even the devices that are put in your heart so that they can pace up or they can help the heart to be okay. Now we can see, let me usher in some people, some of my good friends that are here right now, like I am Naliaho, Smiler in the city, Jamaican uncle, J King Ray, Sha Travels, always a pretty lady, you see, I say when you call someone a lady was an important name to call someone at the palace in England. My lady is a respected person in the palace of the queen. Yes, you get. So when I call you my lady, yes, just know I respect you, and I really humbly respect you. Now we continue. We can see King Ray, Judy in the house, my friend, a very humble lady there. We can see Barbara's World in the house. All of them here and supportive and always checking out for each other. So if you are coming in, say hi to the chat. Don't just come in and don't. Big up Gabriel Mwao. I see you Gabriel, my brother. I see you Gabriel. I see everyone. Smiler in the city is an emperor. That's a new word today. Emperor. So when you get an emperor, that is person who has integrity. When this emperor talks, the words are coming out with integrity. They are respected people. So true, Dr. Benjamin. You should always put our ladies on the highest level at times. Always, Jamaican uncle. You are one of the most important emperor, just like Smile in the city. And I call our ladies empresses. Empress number one, girl, I wanna be with you. Say a real woman, yes. That one is one tune from the Richie Spice himself, and he was saying that empresses should be protected and be the most important thing to the society because they brought life to the world. Big up. No, we continue now to our talks today, and our talks today is about what? We are talking about how we treat heart conditions. You get it? And the most important thing where I'm talking about heart conditions, I've said it comes gradually from the birth time. If you are not born with heart conditions, I see. Thanks for the upgrade. Smile in the city. You are always the emperor in the house. Jamaican uncle is always the emperor. People that are always having love, peace, and integrity. Yeah. If you are watching me, please big up. Do the like button. Don't forget to say hi to my people in the chat. Say hi to my people in the chat and let's grow together. I know there are so many new people that are watching now. I can see Dorothy K, Empress in the house, bigging up everyone, saying hello. Now, we have talked a lot about the heart. But my point today, even if I'm going through all these drugs and devices, my point today, if you have not liked, my friends, please hit that like button. Let's move. Let's make that up to 30 or 50 or so and everything. Boss One, Mr. Procurement is here. Boss One, today I want you to bring down, give them all the links I want us to today. Today, as we are treating the heart, as we are giving the drugs, as we are giving the devices in the heart, as we are giving people the devices, Boss One, we want to give even bricks by bricks. You give the bricks in. Share those links in the chat, Boss One. I can see you, and everyone who is in the chat, please don't forget to follow Boss One. Boss One is a very humble emperor, a person who is having integrity and socially very upright and good character. We love Boss One because he is the one who gives us all the links at the chat. Welcome, Boss One. We thank you. We thank Mnaliaho. I can see you there, everyone. Now, my point today, and this one goes to everyone out there. My point today goes to everyone out there. Heart conditions, they come so gradually. And as they come so gradually, I want you to notice this. You may not get them at the age of 28, 25, 26 if you are not born with them. As we have discussed everything, we have gone through everything. You notice they come at an elderly age, but it is a thing that you've piled it from some time. We love you, Boss One. Up, clean yourself every time. That is from the emperor himself, Jamaican uncle. Yes. Big up all the time. My point is, start taking care of your heart when you are young. And us as parents, because we know and we have gone through all the society processes, and we know how they come, and now we are enlightened, we should take care of our children, not to get themselves into things that can make their hearts be bad, because the heart is life. The heart is life, yes? Now, the treatment of heart conditions involves combination of medication, surgical interventions, and medical devices. You get that? Let me repeat that. It's very important. Now that we have, some people are born and then they are living with the heart condition. It involves combination of medications, surgical interventions, and medical devices. Depends on the underlying condition, severity, and patient's factor. What condition do you have? Do you have cyanotic or a cyanotic? Do you have myocardial infarction? Do you have all those? You get it? Now, when it comes to pharmacological drug treatment, when it comes to medical treatment of heart conditions, we see that we can use, I'll go through the drugs, then I'll go through the conditions. When it comes to, you have like plaque accumulation because of cholesterol, and then your pressures are so high. Now, you need to have, you get even fibrillations. What do you need to have? You need to have some drugs that will help you to do what? Some drugs that will help you to reduce your pressure so that you cannot get a problem. So these are like enalapril, lisinopril, they are called SCE inhibitors. They help when it comes to reducing blood pressure. We have angiotensin 2 receptor blockers like losartans, beta blockers like metoprolol and carvedilol improve survival and reduce rate of, you see, beta blockers, they reduce the how the heart beats. So it helps the heart to beat slow when the rate is too high. Maybe you have a problem with the sinoatrial node. You have a problem with the sinoatrial node, and it is taking so much interaction of electrical impulses to the ventricles. You know, you take beta blockers so that it can reduce how the heart is beating, the heartbeat. So beta blockers reduce so that you cannot get fibrillations. Hello, Dr. Benjamin. Today I've said hello, Mercy Grace. I can see you here. Welcome so much to the church. I see you, Mercy Grace. Thank you. Today is a random talk and we are treating the heart, and everyone who needs any question, you can ask any question as much as you can. Now we have diuretics. Diuretics, we have said beta blockers are drugs that they slow the heart to beat. When you have fibrillations or tachycardia is when your heart, maybe it has a Kent, you remember a Kent focal point that is producing so many interactions of electric impulses. So when you have it, we can give you beta blockers like metoprolol and carvedilol. If you are watching and you have not liked, please hit the like button. Hit the like button as you continue to talk and interact with everyone in the chat. So if you are new, don't keep silent. Go to the chat, interact with everyone in the chat. It's good to know everyone. If you have a question, just ask. We have diuretics. Diuretics are like furosemide. When you take diuretics, they relieve fluid overload in your body. So the heart gets an easy time when it is pumping blood. The heart gets an easy time when it is pumping blood. You know, fluid overload can do what? Can make your heart, can make this heart do what? Have the left side that is bigger. Because of what? Because of fluid overload, stretching of the heart muscles, and then after some times they become hard and fibrotic. Now, aldosterone antagonists like spironolactone, those are diuretics. They stop Shah Travels. Support my brother by hitting the like button. I thank you, Shah Travels, for that. So good of you for wanting growth. Yes. Like button and subscription. Now, there are two types of diuretics. I've started with the drugs, then we'll go to other things. Two types of diuretics. One is furosemide. When I'm saying diuretic, I'm saying when you take the drug or when you are injected with the drug, you can urinate so fast because it is removing excessive fluids from your body so that your heart can have easy task of pumping blood. So there are two types. One is potassium sparing, which is spironolactone, aldosterone antagonist. The other one is called furosemide. That one does not spare. It removes everything. It removes sodium, the fluids everything. So if you have heart problem, I usually tell people check your potassium levels, and if they are okay, use aldosterone antagonist like spironolactone. Reduces mortality in severe heart failure. Why? When you use spironolactone, it helps. If you are a patient and you are on long-term diuretic cover, if anyone here is on diuretics, please use spironolactone, because it takes care of your heart. It takes care of your heart. It preserves potassium, which is important for your heart. You get it? A and I, like valsartan, the superior to AC. Valsartan are like antihypertensive. You know, when you are hypertensive and the heart is struggling to beat, it may bring so many effects. High BP for long can give you a blood clot, because you can get fibrillations and tachycardia, and then you get a blood clot. The clot goes to the heart vein, like the coronary vessel, and then you get MI. MI can lead to, MI is mitral myocardial infarction, and then you can die. We don't want to talk about that. Cardiac glycoside, digoxin. So many people nowadays don't use digoxin, but it is still used because it helps improve the cardiac output. Digoxin improves the output of the muscles. Yes. We have some empagliflozin, sodium glucose. The links will not, since the phone is portrait mode. I stand to be correct. Try to click on the links. Oh, okay. No problem. Okay. The links will not, since okay, it's okay, no problem, boss one. Let's continue. So the empagliflozin reduce mortality in hospitals. You see, these drugs, as I'm saying, the ones that I've named, they are drugs that are used when you have heart conditions and you have hypertension. So if you look at about these drugs, now we are treating the heart. You can only have hypertension when you have heart condition, when you have fatty plaques. You see, fatty plaques are brought by high cholesterol levels. So let's continue, and we go to coronary arterial diseases and heart attacks. Coronary arterial diseases and heart attacks. No, coronary arterial diseases are the coronary artery, are the arteries which serve the heart with blood and nutrients. You get it? They serve the heart with blood and nutrients. That's why they are called coronary arteries. So check it out. The drugs that I'm going to name are just drugs that are releasing and taking care of the arteries not to get damage. You get damage that has been piling up for so long. That's why I said important to talk to the other generation to take care of themselves well. Like antiplatelets, aspirin, clopidogrel, they prevent clot formation. You see that? They prevent clot formation because of long time use of bad things like smoking, and then your heart starts to get fibrillations. So when your heart starts to get fibrillations, what happened? Smile in the City, when I click the link you have shared, it opens your profile. Oh, okay. Oh, nice. Okay, I see. That is nice. Okay, we continue. If you are new, please click the like button. We are talking about heart conditions and how to treat them. It's a journey of cardiology that we have started. So if you are new and you are watching about treatment, Ridley is here. Morning, everyone. Ridley. We are so nice here. We are talking about heart conditions and how to treat them. So really welcome to the chat. We welcome you. Big up every time from Jamaica. Ridley 1963. Now, well, aspirin makes your blood to be light. so that even if you have some constricted veins, boss, that is what should happen. Yes, if you click in the link, you are supposed to go to the link of the person, which is okay. Yes, I smile. That is very true. Now, when you have, let's say, fatty plaques in your arteries, and then you take aspirin, it will make your blood to be light. So when your blood is light, it passes through them so that you get more oxygen in your brain and your heart again through the coronary vessels to get oxygen and nutrients. But when your blood is thick, it takes more time to flow inside. Before you get the oxygen and nutrients, you are suffering. You are getting cyanotic. You remember how we talked about cyanosis? Remember, my people, today, if you have some time, please ask questions. If you get some time, ask questions. Let's know who is having this. Queen B is in the house. Good morning, everyone. Happy Saturday. Blessings to you, Mercy. Sorry, I didn't get to live stream this morning and sleeping. Okay, it's okay, Jamaican uncle. You will watch autocorrect. It's affecting my typing, and I'm sorry, typing correctly. Okay, boss one. Now, we go to thrombolytics like anti-atelepase. Thrombolytics are drugs that dissolve clots. So then we have something called an alteplase, which dissolves clot in your blood. But you see the problem with these drugs, you are not supposed to be given several times. So as they dissolve clot in acute, when a clot, let me remind you about something on this. Let me remind you something. You see these coronary arteries that are here, when they come back to the heart, an MI, myocardial infarction, can occur anywhere here because of there was a clot in this artery somewhere. There was a clot in this artery somewhere, and blood is not reaching the heart muscles as needed, and blood is not reaching the heart muscles as needed. So what happens is, because the blood is not reaching the heart muscles as needed through the coronary arteries, there is no oxygen that is reaching that muscles, and without oxygen and nutrients, the heart muscles die. So what happens to that muscle? It starts functioning in the wrong way. You start having blood building up in one side of your heart, which is not good. So when you have myocardial infarction, we give atelepase to try if there is a clot along the way, to dissolve so that blood can go where the muscle is dying to get more oxygen, so that metabolism can continue and those cells there cannot die. Now, those are the drugs that we use. You see, we are talking about things that happen, and we can prevent them even before they happen. Prevention is better than cure, but now we are treating because it has already happened. Gabriel, I can see you, you're still here at large. Energy at large. Now we have statins, atorvastatin, that lowers cholesterol levels and block stabilized plaques. I can see Roger Skillia in the house. Blessings, Roger Skillia. Thank you so much of logging in, and please check the WhatsApp message I sent you. Please analyze some things for me, and I'll be so happy. Even J. Kingre, I can see you. Now, atorvastatin always lowers cholesterol. You see, things that I'm talking about are things that people get after a while, and these are things that we can make them go. We can make them to disappear early in life, not getting into danger. We have anticoagulants like heparin and warfarin, which prevent clot propagation. Most of the heart diseases, watching while cooking, working in the hemodialysis center. Queen B is working in the hemodialysis center, taking good care of our patients with kidney failure. Please continue with that heart. It is very important to make people live good. Now, Queen CNLB has said hemodialysis. Dialysis is a procedure that people with kidney injuries and their kidneys cannot sieve, let me use that blood well. So you are taken there for dialysis to sieve the blood so that you can continue living well without having pile of toxins in your body. So thank you so much, Queen CNLB. God bless you for helping those people and even your service to the humanity where you are. Thank you so much. If you are watching me today, Benjamin the Wise Guy, welcome to the community. Like and subscribe always. Let's make a community smile at large. Now, for just what I've said, the drugs that I've named right now, they are for coronary artery disease and heart attacks. Antiplatelets, thrombolytics, nitrates, statins, and anticoagulants. Nitrates, when you have chest pain, and we know it's coming from the heart, the safest way and the faster we can start with is to give you nitroglycerin. It relieves the chest pain. It is safe. Antiplatelets like aspirin and clopidogrel, they dissolve clots. Yes, thanks a lot, Boss One. They dissolve clots. Statins, they lower cholesterol, like atorvastatin. Anticoagulants, like heparin and warfarin. What do? Like heparin and warfarin, they prevent clot formation. Margaret in Norway, my sister, welcome. I see you there. I'm happy that you are here today. We are treating the heart today. Today we are treating the heart, and we are so happy to see you here, and you are good and you are doing so well. So those new people that are coming in, hit the like button and let's continue and learn about taking care of our hearts. Rogers, my kaka, jambo. Rogers, continue teaching Sha Travels Kiswahili so that when she'll be here, she'll be speaking fluent Swahili. Continue that good job. Busy in the background. Thanks as you watch us, Sha Travels. Now, those are drugs that treat coronary arterial diseases and heart attacks. We have talked about them. We have arrhythmias. And you remember what arrhythmias are? What are arrhythmias? Arrhythmias are bad rhythm, high rhythms or slow rhythms. Big up yourself, Queen Rogers Killer. Boom. Hey, so much. I can see Rogers in the house. Rogers doing his thing. And I've told Rogers to teach Sha Travels Kiswahili so that when Sha Travels will be in Kenya, we will be talking even Sheng. Understanding every word by beat by beat. Now we have arrhythmias like beta blockers like propranolol. Hi Smiler, I will now next week. Okay. Asante sana Dr. Ben. Hey, you see, Sha Travels now is a one of a kind. Sha Travels speaks Swahili. You see. I hope it's not Sha Travels. Hope it's not translator. Google Translator. You know, some people can use Google Translator. Google Translator to translate. You see? No. Let's continue, my guys. If you have a question today, it is an important day of the heart. We are treating the heart. If you have a question today, please don't fail to ask any question today. Ask any question today, because we want to clear the heart and start something that some people have been asking for so long, but it's open as we continue. Can seek for advice anytime and any place. Let me recap the people that are in the house today. Jamaican uncle, our big boss, is Emperor, His Majesty Emperor himself in the house. Margaret in Norway, my sister, we miss you so much in Kenya. Wherever you are in Norway, always know that we love you in Kenya. No, I'm one of you. Yes, Sha Travel, my lady Sha Travel is one of us here, and we love you so much. Thank you so much, Gabriel Mwao. I can see you still intact. Smile in the city still intact. Roger Killer, boom. Yes, the one who always bigs up out and makes the stage to be clean and make us to talk and talk and talk. Roger Skiller, we love you so much. Jay Kingray, the humble lady in the house, we can see you, we love you. Barbara's World, always Barbara's World in the UK. Remember to check her out. Barbara's World channel, always doing a good thing. Thank you, Benjamin, for the title. Emperor. The American uncle should be an emperor. Smile up here. You yourself too should be an emperor. We always sing for ladies. You see, many songs are sung for ladies, and these songs are sung through from the emperors. Glorifying their work of keeping the king clean, of keeping the men good. Women are important factors in the life of the world, so respect the women too. We thank you everyone who is watching. Now, we are continuing with our talk here, and it's a very important talk about taking care of our hearts. Not emotionally, we will talk about taking care of our hearts emotionally, but right now we are taking care of our hearts physically by using drugs that we use. So now we are going to arrhythmias. Beta blockers are propranolols. What they do, they help the heart to beat slowly and slowly. If it's beating so fast, you will remember the types of arrhythmias we had. Focal arrhythmias, we had tachycardias. You remember we had, let me revise them, it's very important. We had ventricular tachycardia and we had atrial tachycardia. We divided them. So we had focal atrial tachycardia, monofocal atrial tachycardia, we had atrial fibrillations, and we had monomorphic atrial fibrillations. And now we went to ventricular tachycardia, and we discussed them. So all those, if they are beating so fast, sometimes we give a drug like propranolol. We give a drug like propranolol. Propranolol is a drug that makes the heart to beat slowly so that you cannot have problems. You can have high beats, high tachycardias until you get atrial flutter. Atrial flutter can lead to heart attack. Monomorphic paroxysmal are not so bad, but when it comes to atrial flutter, that is bad. We have calcium channel blockers like verapamil and diletazem, and even we have something called nifedipine that is used in Africa so much. You remember when you block calcium to go to the muscles cells, what happens? It relaxes. It does what? It relaxes. So your BP goes down. That one works in the veins and the arteries. And the arrhythmics like amiodarone and lidocaine. When you give someone a drug like amiodarone, if you are having a very bad arrhythmia like tachycardia, let's say monomorphic tachycardia, that one it reduces. But a drug like amiodarone is not given to AVNRAT. You remember arterial ventricular return tachycardia, the one that we learned there, arterial ventricular return tachycardia. I'm driving, can't participate. It's okay, Ridley, just listen to us. And as I nope, I'm one of you. Okay, as we continue. If you have, let me talk about this. If you have a return focal point that is returning here, going round. So this one is giving a heat impulse of electricity, and the sinoatrial node is giving a heat impulse, and it is going on continuously like this. You should not give an amiodarone. If you have nodal return, the other one, which is AVN nodal here, don't give amiodarone. This one can kill the patient. It can kill the patient. You see, you should give a device to deflect the focal point, or go to surgery to remove the additional focal point, so that this person can have a normal rhythm. I get your message. You heading back now. Hi, King Ray. King Ray, my sister is saying hi. I don't know if you are still around. Now, we have said arrhythmias, amiodarone, and lidocaine. So, if you have monomorphic is when you have just a tachycardia that is coming from the sinoatrial node, or focal point. That one you can give amiodarone. But the return ones we don't give. There are two. Atrial ventricle return tachycardia and atrioventricle nodal return tachycardia. Those ones we don't give amiodarone unless it is after surgery. Now, hypertension, anticoagulants for fibrillation, apixaban, anticoagulants for hypertension like apixaban. These are drugs that helps in arrhythmias. We have hypertension. If you have hypertension and it's giving you problems in heart conditions, we give calcium channel blockers like amlodipine. We give diuretics like hydrochlorothiazide, spironolactone, and furosemide. Furosemide, for me, I like giving it short time, not long time, because it can bring some other things like constipation. So big up every time. If you have a question today, don't fail to ask. Today we are dealing with treatment of the heart conditions that we have been going through. So everyone who is in the house, who is new, no problem, really keep on your eye on the road. Yes, really keep your eye on the road. It's very important. We have I get your message. You are heading back. Yes, Jamaican uncle. I see that. ACE inhibitors and ARBs are listed above. Those ones are antihypertensives. So you see how drugs are. These drugs that I'm talking about are drugs that are treating something that has piled up after some time. So like we go with my friends every weekend. When you are in school, you are still studying. When you are still studying, your pockets are dry because you are depending on your parent, everything. And then when you have come out of school, you are hustling now, you have got something. You start living that life that you really wanted to live. You wanted to go out with your friends, you wanted to drive a good car, and most of the guys always want to go and talk to your friends when you are taking booths, when you are taking a bottle, and when you're taking a bottle, you can't go down just like a bottle. You feel nice and take. Here in Kenya, we take nyama choma, meat that is roasted, kebabs. You don't want to eat what your parent was giving you. You see, you don't want that. You want clean things that are cholesterol filled, clean things that are giving you problems in your body, and that is always between the ages of 30 and 40. Now that is where the problem comes. Within 10 years, my friend, your tummy is more than 90 centimeters. Cholesterol have piled up. Freedom is there. You want to do all things, and remember, fatty plaques are piling up in your veins. Not stress-free. So, after doing that for so long, after getting that, You start having now children. Children are coming up. These children need support. They need school fees. The money is not working out because you are getting salary. Now stress starts to pile up. Stress plus what you have been eating and everything brings now fatty plagues. I'm glad that coffee won't give you heart attack because I don't have a cup every day. If I don't have a cup, I give me headaches. Also, it helps me give energy too, but I only take 1 cup a day. That is good, Jamaican uncle. That is good, Jamaican uncle. That is very nice. Don't take coffee after taking supper though. It will not be good in absorption and digestion. Take coffee earlier. Which family planning method is suitable for someone with heart condition? A very important question. Before I finish, that is the question that I will talk about before I finish. Which family planning method is important for a person with heart condition? Because you see, family planning methods are a product of hormones. We give hormones and then we do what? And then we stop. You saw how we talked about family planning. Follicle gonadotropin releasing hormone is stopped, and then luteinizing hormone and follicle stimulating hormone don't work. Then you don't produce the eggs. Ovulation is stopped. You see? Yeah. Let's continue. I see so many people today here. So continue liking, guys. If you are new, continue hitting the like as we continue. Now, we have talked about all those drugs that are treating hypertension, those drugs that are treating coronary artery disease, blockages, clots, and so. Because if we don't treat them, what will happen? What will happen is, which exercise are recommended for a person with heart condition? Yes, that one I'm gonna say it again. I can see that is boss one. Boss one has asked which exercises are recommended. So stay tuned. As I finish, I'll go to these questions one by one, moja kwa moja. Yes, in Kenya here we say moja kwa moja, one by one. I'll go to those questions one by one so that we can deal with them as they are. I can see J. King, I think condom is the best, but I'm not a doctor, Lord. Yes, condom is the best because you don't have much to do. You worry, just block it. Rogers Kilia, always the funny guy, but I miss your brother today. I miss your brother Savior Man. If Savior Man could be here, that could be a boom. You've lit up the chat, eh? You've lit up the chat. I can see Rogers Kilia. No, Rogers. We have talked about the drugs. Let's go to surgical and interventional procedures. Surgical and interventional procedures. Surgicals indicate when medications are insufficient or when structural abnormalities exist. You see, when your heart is beyond repair, maybe a part has died or the valves are beyond repair. Savior Man, you will see him. You will see Savior Man here just now. Savior Man, greetings, Rogers. You see, you've made even Barbara to come out. She was silent. Now, surgical and interventional procedures, when the damage has extended so much and you cannot even help without it. Check it out. If you have not liked the chat, please, guys, let's continue hitting the like button. If you have not subscribed, my friends, if you have not subscribed, you are losing a lot. Because you see, I'm not the only one. My subscribers, my friend, I call them my friends. Hey, something else. You will not be lonely when we are online. We like we like talking and helping each other and making each other to laugh. Now, coronary arterial diseases. One, the coronary artery disease. The coronary vessel, the artery, is the artery that comes from the heart and comes back to the heart muscles to give it oxygen and what? To give it oxygen and nutrients. You get? I had left branch. Oh, okay. Short travels. Now, that one, there is a procedure that is done which is called percutaneous coronary intervention. Balloon angioplasty with placed stent. You see, a balloon is placed so that blood can continue to flow to the heart muscles, because if they don't do that, that place will die. Yes, we have a good family, so I like to be around them every day. I know Jamaican uncle, everyone here. Once we see Jamaican uncle, once we see Short Travels, Barbara in the World, Boswan, Roger Skillia, all of you. I know everyone feels nice. J. King Ray. Where is Mercy? Mercy, where are you? Where are you? We miss Savior Man. Who has Savior Man's number? Where is Savior Man? Where is Savior Man? We miss Savior Man today. Smile in the city. Hey, we see Ridley here. When we see all these people, we smile and we feel life. God is giving us life. So, guys, if you are coming in right now, give the like button on your screen as we continue treating our heart. And if you have a question, put it up, because after I've treated my heart, I'm going straight to the questions. So, percutaneous coronary intervention, balloon angioplasty with stent placed. Indications of this is acute myocardial infarction. Acute means, let me check out if myocardial infarction. Let me explain this. This one is an important one. When you have your heart is there. Let me draw a heart. I'm drawing a heart. I think I have to get his number next time I see him, Dr. Ben. Yes, Savior Man, we need the Savior Man's number. Very important. So this is the coronary artery that comes from the coronary. I'm drawing a heart. I want to explain something about these coronary vessels. We have the large. We have this one. We have coming like this. This pen is not working out correctly. Let me get another one. If you are new, my friends, don't fail to hit the like button. Here we laugh, live. Where is live, laugh, and laugh? So you see, this picture is of a heart. This is this is the coronary blood vessels from the aorta, and it has come back to the heart to serve. And maybe somewhere there is partial blockage of the artery, like this. You see, let's say subscribe, very important. So we see this one is, let's say, is a clot. So they put a balloon inside to push this clot, and then blood can continue to be served in the heart muscle, because as the blood comes, it stops here. This area can die. So with the stent, it helps to make the flow of blood to the heart muscle to continue, because we don't want this area to die. We don't want it to have myocardial infarction. Myocardial infarction means this place has died. You see, severe coronary stenosis. And mostly, when you have the coronary artery that has stenosis, that has constricted, we put a balloon to fix it, to balloon it, so that blood can continue to be going there. Coronary artery bypass grafting. Now, bypass is another thing. Now, bypass is this. These are surgical ways. Now, where is my red mark? This one. My red marker is here. Can your heart repair itself? Smile in the city. Very important question. So, you see, when this is totally closed here, So you can bypass this to come here. These are surgical here, and you leave here. So that blood, when it is coming, it is going to this and it's supplying the heart. Blood is coming, going here and supplying the heart. You have bypassed the place that I am Jacob is in the house. Welcome, I am Jacob. You have bypassed the place that was having a problem. You see, you have bypassed a place that was having a problem, and that is a surgical procedure. Bypass blocked coronary arteries. Indication: left main coronary artery disease. You see, triple vessel disease or failed coronary artery diseases. There is something else that we need to know. The heart can have a problem with the valves. These valves, the heart can have a problem with these valves. The valves, you remember when we were talking about mitral valves and mitral stenosis, is surgery help to heal damaged valves completely? Surgery, missing? Yes, Kingray. It depends with the problem that you have on the valves. You see, sometimes the valves can be damaged until even a stent cannot help. I'll answer that in full, Kingray. Don't worry about that. It is coming and I'll answer it in full. Now, there is another question that has been asked. This is, can your heart heal? Can your heart repair itself? Even this one, I'll answer it in full. So don't go away. Just wait until we answer all these questions, because it is very important to know how the heart behaves. So let's continue. We have valvular heart diseases, the valves themselves. Valves repair or replacement. Replacement is called the stent. If you're coming in now, please like. If you are new, subscribe, my friend. If you are new, subscribe. Now, valves repair or replacement. If these valves are beyond repair and you are looking at them and you know these ones cannot happen, when you do an echocardiogram and you see they are really damaged, these ones you cannot repair. There is something we place as a valve. There are stents we place, mechanical and bioprosthetic. You see, they are placed here at the area of the valve so that they can do the work as the valve. You get it? And severe indications is severe stenosis or regurgitation. Severe stenosis means they are short and thick. They are not even doing the work of the valve. They are really constricted. And regurgitation is you have severe backflow of blood. These valves are not even holding any blood. You have severe backflow of blood. So when you have severe backflow of blood, what happens? We remove the valves and we put another one, plastic valve. Now I can see so many people here ask questions, because today I'm going to talk about those questions about the heart. Now, indications is we have said is stenosis and regurgitation. The valves cannot even hold back the blood. You see, your valves cannot even hold back the blood. So someone is here wanting me to answer him politely. Let me answer this politely. So if you have a question, please don't fail to ask. So we continue. Like and share this. Share. We get so many impressions. So valves, we have said that what we can replace. We can replace with silicone ones, plastic ones. There is something called transcatheter aortic replacement, minimal invasive alternative for high risk patient. Transcatheter, it's like a catheter we place and it works like a valve. In heart failure, now the heart is, we talked about heart failure. Heart failure means the heart cannot do its work 100%. It's working, but it's not failed. It is not dead. Some people are telling me in heart failure the heart is dead. It cannot work. No, heart failure means the heart is working, but not 100%. You can do heart transplantation. Indication is when end-stage heart failure and responsive to any therapy. Unresponsive, that's where we can do. It is working, but it's not giving us enough that we require of the 40%. Ventricular reconstruction, the ventricles, for severe ventricular damage for myocardial infarction, the ventricles have been eaten until they are dead. So that one we do a transplant. There are some things like, we talked about congenital heart problems. Congenital heart problems are the ones that people are born with. Surgical corrections are important. Those ones, we don't have any other option. Like septal defects. Septal defects, you remember, like we talked about acyanotic and cyanotic. So for cyanotic, we talked about a hole in the septum. We talked about coarctation of the aorta. This is tetralogy of Fallot. And then we talked about this one being bigger. And then we talked about the right ventricle being bigger and stretchy. Those ones, if you have a hole between the septum, and then we have patent ductus arteriosus in the condition we talked about that is called tetralogy of Fallot. That one you have no option. You have to do what? You have to do a surgery. You get it? That one you have to do a surgery. So patent ductus arteriosus, that one is in the one we talked about. Tetralogy of Fallot, all those, they have to be surgically corrected, closed, so that blood can flow where it's supposed to be flowing. You get? So there are some devices. If you have a question concerning what I've said, please continue asking. I can see Smiler in the City telling people subscribe. I think I have get this number next time. Oh, that is for Savior Man. Very important. Savior Man always leads up the chat. I can see Roger Skiller giving some love. I'm Jacob, always here. Jacob is we thank you for coming in today. Say hi to everyone, interact with everyone that you are seeing. We see Smile in the City there. Which exercise? That was a question from Boss One, and I'll help it. And as we talk, I'm glad coffee won't kill you. Jamaican uncle loves coffee. Who else loves coffee, my friend? Who else loves coffee? Now, let's go to the cardiac devices. People have asked about these devices for so long. Cardiac devices. What are the cardiac devices? What are the cardiac devices? Cardiac devices are devices that are placed in your heart to make your heart continue with the pace. You get? We have rhythm management device. I'm outside walking, my friends. Walk, make everyone walk. Jamaican uncle, make everyone walk. Walk every time. Be healthy. I wish one day I see Jamaican uncle with Barry walking exercise as they walk and talk. You know, Barry has another vibe. He's always jovial, and as he walks, he talks, man. And you feel now this energy is at a higher pace. I really wish to see Barry with Jamaican uncle one day as they walk, as they talk. That collab can be so fine. Now let's check out the devices that we put on a heart of a person so that they can help this person to be. How bad is it if you don't take your meds every day? I'm trying to stay on these meds. Okay, this one is a question of importance, so I will answer it after I've finished this. Share travels. That one is a message of importance, and I think should be addressed in an important way. Let me put it on a waiting list. It's so true, Doctor Jamaican uncle. I would like to see you. By the way, I would like to see you, Jamaican uncle, with Barry walking exercise, walking and talking. I would really like that. So if you are coming in today as a new person, you just met Benjamin the Wise Guy, please tune in, subscribe so that you can get notifications, hit the like button, and if you have any medical question or interaction or something that you may want to tell us or add to what I'm saying, or you have an experience, this is the platform that you can do it. I'm in the background. My sister, I know you are in the background listening to your big bro here and laughing when I'm tripping. Yes. Thank you so much, my sister. Okay, we have pacemakers treat bradycardia and heart blocks. Bradycardia are low blood pressure, and heart blocks are when the electrical impulse is has gone, and then there is an MI here, something has died. You get that? This electric impulse cannot pass. It means there is a block here. So the electric impulse is not passing. That is called a heart block. So pacemakers take it and they continue helping the heart to continue normal. Implantable cardioverter defibrillator. Now we have something else that is called the defibrillator. Defibrillator, yes. Now, what do you understand when you hear about a word called fibrillations? Fibrillations are abnormal arrhythmias that are so high, tachycardia. So, guys, I can see some new people. Hit the like button, new people. Hit the like button and subscribe. Now, see, defibrillators are those that when the sinoatrial node is producing a lot of electric impulses, they reduce the faster brings back to life. Yes, bring back to life. Yes. You see, they reduce the faster impulse that is being produced. You get, prevent sudden cardiac death, because fibrillation is tachycardia that is so fast, the heart beating so fast. So the defibrillator stops the faster impulses, electric impulses, and reduces them to normal heartbeat. You get? So it means bringing back to, guys, you must give the live stream a like with all this great medical information from Dr. Ben. Thank you so much, Sir Travels. Thank you so much, Sir Travels. We have cardiac synchronization therapy. Cardiac synchronization therapy improves coordination of ventricular contraction. Now, we don't just give pacemakers, because I know people know of one thing, pacemakers. But now you know of like 3 things. You know pacemaker, you know implantable cardiofibrillator, and you know cardiac resynchronization therapy. So those are the devices that are implanted on your heart when you have a problem. Pacemaker, it gives pace to a heart that is beating slow, bradycardia, and heart blocks. When you have a heart block, when you have a heart block, your heart beats so slow. But pacemaker reignites it and it continues to the normal. But we have implantable cardioverter defibrillator. Your heart is beating so fast and you can soon get to a stroke or a heart cardiac death. So it reduces the faster beating to normal beating, to normal pace. You get it? And then we have cardiac resynchronization therapy. It improves coordination of ventricular contraction. So you can have both sides. Okay. I can see Shah Travels has a pacemaker. So it means Shah Travels has a heart block. Shah Travels, it means you have a heart block. If it is one, it is on the one side of the bundle block. If it is one, look at this. If it is one, you have one on this side of the heart. But if you have two, you have this side and this side. It means the MI may have affected after the bundle of his. So it is affecting both sides. The signaling that is going through the heart is little both sides. So if you have one, it means one left bundle may be a problem. But if you have two, you have a condition that is affecting both bundles that are going down through the bundle. You see, that one can be a problem. Now we continue. So don't worry yourself about that. If you have a pacemaker, it's a good thing. It makes your heart continue well, and you live forever. And you live forever and ever, because it is a nice device that helps you to continue with having life. So don't worry yourself, that is a good thing. It will help you forever. So I know when we will meet with Shah Travels, we will have to interact more, and I'll give more insights to her. Thank you so much for telling us this. Thank you so much for this. This is very important. So guys, if I have a dual pacemaker, a heart attack 1 year ago. Dual, it means both of your bundle blocks, your bundle branches were affected. I'm sorry about that, but you'll be okay. Shah Travels, life is given by God, and God makes us happy always. So let's be happy always, and let's inspire others. Let's continue making life good to everyone. This is Haiti Finest. Hello, my sister Haiti Finest. I see you here. You've gone so long. Where did you go? I've not seen you for some time. Since some issues have been coming and going. Hit the like button, Haiti Finest, and share with us where you are. Don't get so lost so much. When you have a family, even if it is online, it's been a while. Yes, when you have a family, even if it is online, make sure that you visit them. Tell them that I am here, this is what I'm undergoing, and this is what I'm facing. Yes, you can give a word of advice, and sometimes you can make you feel better. You get? So it is very important. People care for you out here, even if you have not met. You get it? So hit the like button if you're just getting in as we continue. Been through a lot, Doc. I understand. In Kenya right now, people are going through a lot of things, but we thank God for life, and God will improve everything for everyone. That's why I usually say, when you are with me and we are in the group of brick by brick, I want you to be there solely, because what is making people right now at an ease is finances. So if you can get somewhere, you can get something like the channels that we are using, and we help people by brick, and then we grow. Someone might put a smile for herself or himself. A child somewhere may get something on the plate. By what we are doing as brick by brick may help someone to pay some school fees for a child. So don't take it as a simple thing. Please take it as a good thing that we are doing it. Yes, I can see Dude's page. Blessings, Dude's page. Welcome to the chat. We are treating the heart right now, as we have been talking about the heart. Yeah, I know, Doc, but at times it's hard even to explain to the people. No worry yourself. Just explain to the admins there. The admins are human, and the admins talk to people, and then we continue Haiti Finest. If in life and this is going to everyone who is watching, you can have a way you can assist a person to help him or herself to do something better for her life. Please do, because many things go down, and when things go down in a bad way, we feel bad. Let's continue. I don't want to get emotional. We are treating the heart. IT finance is okay with prayers and everything will be okay. I'm just saying, when you are out there and we have not seen you for some time, please tell someone to post and say, I'm doing okay, or I'm doing this, I've traveled, so that we know. Yes, we were talking about rhythm management device, and we have talked about pacemakers, we have talked about implantable devices and cardioverter defibrillator, cardiac resynchronization therapy. You see, we have talked about that. We have mechanical circulatory support. Now, this is mechanical. This one means now your heart, one side or both sides are dead. The ventricles should be assisted to push, because if they are not assisted, you will not push any blood to the system. We have left ventricular assisting device. Supports circulation in advanced heart failure. When your heart has an advanced heart failure, it supports the push, the contraction, so that blood can. We have intra-aortic balloon pump used in cardiogenic shock. You get? IT finance, stay strong. God is in control of everything. Please, hugs for Haiti Finance as we talk to her, as we continue talking to her and giving him her energy to continue not to give up. Let's give Haiti those hugs. We have extracorporeal membrane oxygenation, provides temporary heart-lung support. Now today we have learned about some things that are very important, like the devices. I've explained the pacemakers. Hank, hi Dr. Ben, welcome to the house, Hank. Yes, thank you so much being here. Hit the like button and stay tuned. If you asked a question, I'm just going now to the questions. Hank 47, I told you to link me up. I've not seen your text anywhere. Please, I'm waiting for your text. So we have learned about the pacemaker, in implantable cardiofibrillator, cardiac resynchronization therapy, and then we have learned about the left ventricular assistant devices, intra-aortic balloon pump, extracorporeal membrane oxygenation, provide temporary heart-lung support. Because when you have let's say someone has had an accident and there is a piercing in the heart. So as this person is being taken for surgery, he needs to be provided with the lung support thing. You understand? Yes, that's why we should go on some small channels and can get always support by getting at least 1 or 2 subscribers. Yes, very important Jamaican uncle. That's why I call you the emperor. You care about everyone. An emperor is a king. A king is a ruler of the land. He should feed the land everywhere, despite of every gender, what religion. A king is a king. So Jamaican uncle is like a king, the emperor. You see, he cares about everyone. Even Smiler in the City, every channel you will see Smiler in the City there. Share Travels, you will see her every channel, be it a small channel or a big channel, you see them there. So guys, if you are checking in now, don't forget, your like is very important. Please hit the like button as we continue. So those are the devices that we have learned today. Very important devices that we have learned. very important devices that we have learned. Extracorporeal membrane oxygenation, acutely when someone is being taken for surgery. But I will still go back to my first point. My first point is what? This supports all the treatment measures, lifestyle and preventive measures. Before I finish, if you have any question on treatment and devices, please put it now. But before I finish on treatment, listen to this. Lifestyle and preventive measures are very important. Lifestyle and, yes, we are here to support each other grow. Very true, Jamaican uncle. Very true. We are here to support each other grow. 1, healthy diet. These ones are notes to note down. Healthy diet, low salt and low cholesterol, regular exercise. I talked about exercise yesterday. Smoking cessation, stop smoking. Weight control, blood pressure and diabetes management. BP and diabetes management is very important. Stress reduction, very important. And then routine medical follow-up on what we are undergoing. Check out on that. Very important. Now, let's go to questions now. I hope there is no one who has a question on everything that I've gone. Now I'll answer the first question, which was from Kingre. Which family planning method is suitable for people with heart conditions? Choosing a right family planning method for someone with heart conditions is essential. It's very important to get. So suitable family planning methods for individuals with heart conditions are barrier methods. I can remember when that time, just some minutes ago, our friend Roger Skillia said condoms. Yes, barrier methods and diaphragms are important. They are non-hormonal and pose no risk to cardiovascular issues. Thank you so much for raising those. Let's get those likes to 40 today. No, condoms also protects against what? They also protect against sexual transmitted diseases. Requires consistent and use correctly. So barrier methods is the one, and it's the first, which is so important. Beauty, my sister from South Africa is in the house. Big up Beauty every time. Beauty became a content creator by default. Supporting others until we started subscribing even without videos, until Beauty has a channel. Beauty. Yes, you remember, we supported until you became with a channel. I see you here. Thanks a lot for coming in and tuning in. Now I'm answering. Even if you have come late, it's time that I'm answering questions. Let's flow with the vibe. Let's continue flowing with the vibe as we continue with the show, which is Benjamin the Wise Guy and the Medical Ethics and Talks. Continue with everyone who is here. I can see Jay Hank still here, Jay Kingre, Jamaican Uncle Beauty is in the house. If you are in the house and you feel it, you feel the vibe, say, give a like and say hi. If you are listening from the background, thank you so much. I know some people are busy somewhere where they are. Don't worry yourself. We are together, and every time we push on and pushing on. Now, progesterone only pills. We have started with barrier methods. I'm answering a question from Judy, who is JKingre_ in the building. Now, KNL TV. Happy Saturday, Benjamin. Happy Saturday, KNL. Big up yourself as you come in. Please give the like button. Give the like button your hand. Papa, papa, and then we feel nice. We feel nice, and we continue. This is a question from. This is a question. I'm now stop driving to participate. Thank you so much, Ridley. Thank you so much. It is question time. Question time. Question time. If you have not asked the question, ask. Jamaican uncle, big up true. Yes, yes, KNL. Who is that who's not liked? Please like. Now, we have said barrier method for people who have heart conditions. Condoms, diaphragms are important because they are non-hormonal and they cause no risk to the heart. And then we have another one which is called progestin only pill, mini pill, netherosterone, desogerol containing pill. These ones are important. These ones are important. Why? Do not contain estrogen, making them safer for most heart patients. Suitable for women with hypertension or increased risk of blood clotting. Must be taken at the same time daily. This pill, progesterone only pill, is very important. It does not have estrogen, and estrogen have issues when it comes to hypertension. So if you are in this category, my friends, you really need to do estrogen only pill so that you can be okay. We have injectable contraceptive like Depo-Provera, but before you use Depo, go and check the video that we did on family planning, 3 months, the hormonal ones and their effects. Effective for 3 months and free from estrogen. Depo also is free from estrogen. So most people with heart conditions, you are advised to use hormonal methods that does not have estrogen in them. May cause weight gain or irregular menstrual bleeding. That is Depo. Depo can cause weight gain and irregular menstrual bleeding. We have implants like Jadel and Nexplanolone. Nexplanolone. That one is an implant. They put down here. Most women are put down here. It depends with where you want. Women with most cardiac condition due to low systemic hormone levels. You get reversible and convenient. They are convenient. Intrauterine devices like Mirena, they are and non-hormonal option, the copper T, the IUD. Long-term protection with minimal cardiovascular impact. Should be inserted in medical facility, not at home, and it should be inserted with someone who knows. But there are some things that we have, some other methods that are permanent. These are tubal ligations and vasectomy. Men in the house, if there is a man in the house, would you do vasectomy? Any man in the house who will do vasectomy or tubal ligation for women? Women in the house who will do tubal ligation? No ongoing hormonal or cardiovascular risk. If you do tubal ligation, you may not get hormonal problems. Requires counseling and informed consent. You cannot just go to the hospital and you tell them, I want to do tubal ligation, I want vasectomy, and then you are done vasectomy. No, that one takes a period. You are talked to, and then you give consent, then you continue. Methods to avoid or use with caution. Combined hormonal contraceptive, use them with caution. Combined oral pills, patches, vaginal ring containing estrogen, increase the likelihood of blood clot, strokes, and hypertension. So you have seen estrogen containing pills have a problem. They are contraindicated if you have not liked, please remember to give a like, so that you get more impression and continue on and on and on. They are contraindicated in cyanotic conditions, heart diseases, history of thrombosis, pulmonary hypertension, severe hypertension, mechanical heart valvular disease, and cardiomyopathies. We talked about cardiomyopathies, remember? Those are, Judy, now you know, and everyone who has listened, the right pills to use. But in summary about that question is, the right pill to use when you have a heart condition, the right pill to use when you have a heart condition is that one that does not have estrogen. After the long story that you've listened, is that one that does not have estrogen. So that one we have talked about. Let's talk about which exercise recommended for a person with heart condition. So this was a question from Boss1KE. Boss1KE, which exercise, recommended exercise? Walking is one. One of the safest and most effective exercise for patients with heart condition is walking. You see, is walking. If you are coming in now and you are a new person to the platform, subscribe. Don't forget to hit the like button as you subscribe. But if you are new, here we talk, we laugh, we talk about medical things, we help ourselves mentally, and we keep our health at par. So welcome all the people who are new. Welcome all the people who are new. Now, walking improves blood circulation and reduces blood pressure and cholesterol. Ideal for beginners and elderly patients. You see, recommendation always, if you have a heart condition, 30 minutes daily, 5 days a week. 30 minutes daily, 5 days a week. Boss one is in the house, is listening. This was your question. Swimming provides fully body workout while minimizing stress to the joints. Not playing with water. Learn how to swim. Balance yourself in water. Some people play with water. They go put on a swimming costume. They do like this in water, and they have been swimming the whole day. Learn how to swim. Learn how to balance yourself in water. Swimming enhances cardiovascular endurance and lung capacity. Because as you swim inside water, you are helping your lungs to know how to adapt. And even the nerves, you are helping your nerves to align. You get? So swimming is very important. Recommended is 20 to 30 minutes, 3 to 5 times a week swimming. And then we have cycling. I'm a fish in the water. Very nice. Even me, Sha Travels, I do the large pool 8 laps without stopping. That is the minimum that I can do, to and fro without stopping. And it helps my backbone, it helps my nerves. When I'm from water, I feel I'm very relaxed. So if you don't know how to swim and you are near Sha Travels, go for lessons. If you don't know how to swim and you find me near a swimming pool, come for lessons. The only thing I want you to do now is to give me that hit the like button and say yes, I will come. So check out if you have not hit the like button. We continue. So particularly benefits for individuals with arthritis and obesity. Arthritis and obesity. You see, when we're talking about arthritis, we are talking about autoimmune diseases that affect nerves. So swimming helps nerves a lot. Cycling. Water terrifies me big time. Barbara, water terrifies you big time. Why? Why do water terrify you big time? What is the problem, Barbara? You are brought up where there is were you brought up where there is rivers? The first time I saw an ocean, I fainted. The first time I saw an ocean, I fainted. Imagine. But right now, I swim in the ocean and swim in the swimming pool like nothing else. Thank you so much for those loves. Yeah. No, that's why. But you should right now start going to swimming pools, aligning yourself with water. Water is a, hmm? Oh, wow, Dr. Ben, you're joking. No, I'm not joking. I'm saying the truth. Eh? See. Yes. I can do 8 reps and continue. Now we continue with cycling. Cycling strengthens the heart and improves stamina. Who has not liked? Please, let's get to 30-40 likes. 30-40 likes can be done outdoor or at a stationary bike indoors. You can buy the bike that is always indoors, but me, I like the one that you go out and you climb up, you hit the stones, you are stable riding the bike. Outdoor, I like outdoor exercise than indoors. I don't know why, unless I am in the gym. You know, in the gym you have weight, you want to go to the treadmill, you want to do all those tasks. That is where you feel you are feeling it. But outdoor is always the best, because unless you are avoiding pollution, outdoor is always the best. Yoga reduces stress, lowers blood pressure, and improves flexibility. Helps regulate breathing and promote relaxation. Now, boss one, have you ever done yoga? Tai Chi, those ones that go to karate. Tai Chi, slow movement and balance and circulation. Tai Chi. I see them doing this. You see, strength training is building muscle, carrying those muscle building. You see, stretch training improves flexibility and reduces injury. Generally, exercise guidelines for heart patient. Now I'm talking for heart patient. Consult your doctor first. For any exercise, if you are a heart patient, consult your doctor first. Warm up and cool down 5 to 10 minutes. Start slow and progressive. You don't start faster. You give your heart adaptation time, because now you know you have a problem. Monitor intensity, stay hydrated, aim for 150 minutes. Stop immediately you feel chest pain, dizziness, severe shortness of breath, or palpitation when you are exercising. If you are having heart condition, if you feel chest pain, dizziness, shortness of breath, or palpitation, you stop immediately. And if you are a patient or you have a heart condition, exercise to avoid heavy weight lifting or straining exercises. Please stop. High intensity interval training, unless medically approved by your doctor or cardiologist, please don't. Competitive or extreme sports that may make you to go extreme levels, don't get in those sports. Cardiology advised to walk short distance and should not do heavy work. Very important, yes, very important, Kingren. Sudden bursts of vigorous activities, don't. Excitement, you are excited and suddenly you start doing activities, don't. The pace of your heart will go berserk. Exercising in very hot or cold environment is not okay for patients with heart conditions. So stop. I think, boss one, you are happy right now. I've talked about exercise. Boss one, I've talked about exercise. Someone asked the last question. This is the last question that someone asked, that is surgery help to heal valve completely? Is surgery help to heal valves completely? Surgery can significantly improve the function of damaged heart valves. Yes, boss one, thank you so much to be happy. Let's take, who has not liked, let's take those likes to 30, to 35, to 40. Let's like to improve impressions. Now, this question, let me answer it like this. Whether you surgically heal the valves completely, the valves depend on the damage that is done, the surgical method used, and the patient overall health is the key determining factor. Thank you so much to be happy about my answering your question. Thank you so much. Thank you so much. Now, repair, the closest to complete healing. Valve is often the preferred option because it prevents patients from natural valve. When you repair, you get it, restores normal valve structure, maintains the heart natural mechanism, eliminates reduced symptoms as shortness of breath and fatigue, avoids life of blood thinning medications. You see, when you repair the valves, it helps you to just sub to boss one. Thanks a lot. Subscriptions. Let's connect as we continue. That is great, Shah Travis. That is great. So there is some procedures that can be done like annuloplasty, leaf repairs of reshaping, condylar tendinite reconstruction. Those are surgical methods. Annuloplasty means tightening the ring so that the valve cannot be loose. The valve, it's like a ring and then they come out like this. So the ring is tightened. Leaflet repair. Maybe one of the leaflet is weak or it has been eaten. You can repair it. Or condylar tendinite reconstruction. Condylar tendinite is a tendon that holds the valve at place. So you can reconstruct it. Best suitable for mitral valve regurgitation, valves that are not holding blood well, some of tricuspid and aortic valve. You can replace the valve. Sometimes the valves can be so damaged until they are not working. So you can replace them by mechanical valves or prosthetics valves. Valves that are made from the industry and then we replace, they are put at a place. Congratulations, boss one, on getting 1K subscriber. Congrats, boss one. That is what we want. Boss one, big up all the time. Big up. Where I live in Conveyor, I have zero pollution, so I live outside exercise. Thanks a lot. Congratulate boss one for 1,000 subscribers. The growth is imminent. Let's continue congratulating him. Congratulations. Let's continue. Now we have others, minimal invasive transcatheter procedures. Those ones are done to repair the valves. They are very specific on how to repair. Can surgery completely cure a damaged valve? That was the question. Can it? Often restores nearly to the function and is considered closest to a cure, but it will not be 100%. Valve replacement does not restore the original valve, but effectively replaces its function effectively. You get? Transcatheter procedures improve functions and supports, but not to be a permanent cure. That one was a question from one of us, Smiler in the city. Now you have your answer, and I can see brick by brick is doing good. I thank everyone who is always doing. I need you to drink water, Dr. Ben. Thank you. Yes, I will drink. Not right now. I'll drink. I have it here. Boss one, don't be afraid to celebrate with us and the family because it helps others to keep pushing, man. You see, brick by brick plus the other one is helping. Let's congratulate boss one. Just a minute, I take something, I come. And as I come, I'm coming to finish. It is already 6. It's already 6. I'm coming to finish up the live stream. Please, if you have a question, If you have a question, put it up. Give me a second. If you have a question, put it up as I come. Yes, I'm here. I will celebrate soon 1K subscribers on live stream. Yes. Let's celebrate Boss One. Now, the interactive part of this session, my friend, because most of you, we have interacted and now it's like a family. I want to tell everyone that the most important part when you come online, get ideas, even if it is in this live talk of medical and we ask questions and we interact. The most we will support you, Boss One. Thank you so much, Shah Travels. Get ideas of growth, get ideas of development. Don't just come and do some things that and watch people and you are not getting more ideas. Ask yourself, what am I doing, or what can I do to improve on what I have? You see? Yes? You know that. That's good, but we want to celebrate also on admins group 2, boss. Yes, let's celebrate it on admins group 2. It's doing a lot of, now Boss One is the second one. We had the first one, Boss One is the second one. Now, I was saying this, when you're coming online, because most of us are content creators and are participating in the challenges, and so it is good to come online and get ideas on how to improve yourself to the next level. It is very important on getting tips of improvement. Check on other YouTube channels that are progressive and are doing good. What are they doing? Ask your friend, what can I do to improve here or there? You get it? The purpose of Brick by Brick is to help and enable everyone to get where he or she wants. But the most important thing when it comes to content creation is to put you on the world's map. You get it? To put your profession, to put your talent, to put yourself on the world map. Ask yourself, am I on the right way on the world map? You get? Because everyone is watching. If you come live, everyone is watching you. So are you putting yourself on a good stature on the world map? Ask yourself that thing. Give us good content, a content that, Uncle, I don't know about the admin group. Now, Shah Travel, what you do, go to any of my, or let me share. Shah Travel, text number. I'll usher you in, +254 729 736 024 29736. Dr. Ben, I need to write. Where can I write to you? Okay, that is the number, Shah Travel. Text me there. I'll tell you about this group. Junk Hard, if you need to write, this is my email address, benja.okwesh@yahoo.com. So those are the Junk 47, J Hank 47. You can email me there, Share Travel, text me on that number. I'll tell you more about the admins group very soon. So anyone with a question, today has been a very productive day, and we have treated the heart, and we have had some questions, and I see Christine Long, welcome to the channel, Christine Long. I've been waiting for you. Where have you been, Christine, my sister? Where have you been? We miss you at the chat, we miss you everywhere. So, thanks, Uncle. Have learned a lot in prayer. I won't be missing this life. Yes, it's important, Haiti Finance. It's important, and it's important we help each other. The most important part is interaction. For everyone who is here, I'm waiting for any question. Any question, and that one who has not been around, how are you all? Oh, we are fine. We are fine so much. So my point was to the content creators as a whole. Like when I want to share your content to a friend and tell this friend that I'll share you a link of my friend who does good things on YouTube. Been around on Christine Long, welcome on YouTube. Please check out my friend. I should be sending content that is good, that if a person looks at the content, this person feels nice. But do your content. Do content that describes you. Don't be fake. Yes, don't copy. Just do yourself. There is more percentage of people that will like you who is original than faking it. People that like fake things are not more. They are less. You get it? So guys, any question? Anyone who has any question to ask? Anyone who has any question? I'm waiting for questions. I have. I'm left with 15 minutes right now. I'm left. I agree. Just be you. Yes, just be you. Like how I am me. I give my content live and straight. Sometimes. Why are you saying the truth, Doc? Sometimes I for me personally, let me say, I don't know how to edit. I know how to give myself what I have. So when it comes to taking video, then I edit, I add 1 + 1 to make it good. I don't know. I like giving myself, and that's why you see at times when I'm doing my medical talks, I start singing because that is what I love. At times I went to a lecture one day, and then the lecture turned into a musical lecture, and it was a medical lecture. But at the end of the lecture, no cornering doctor. But at the end of the lecture, every student had captured 100% that this student wanted. So they got everything and they passed the exams. I know sometimes being you helps to make everything become nice and everything to flow in a good way. Yes? Yeah? Share Travels, no cornering. So no one with a question. We have dealt with heart condition, but this does not mean raw videos are the best. Yes, Barbara. Raw videos are the best. I concur with you. But when you want to bring in new content, describe something, I know sometimes it's good when you give a video, when you edit some parts. You get by that, or sometimes you can be taking a video outside and then you feel there is something that you don't want in your video, you can edit it. That is why we do premieres. You are 100% right about that, doctor. We are on the world map. I had a vision one day. I still a vision that we have met. So we are a group that we have met and we interact so much. worldwide. And my vision on Brick by Brick and Admins Group is to come up with a foundation one day that will be worldwide. Any person that will be in a state somewhere will be running the foundation where he is or she is, and we have come out with that foundation everywhere in the world. So as we interact in this group and everyone, this is my say, and it comes out of my heart. And as we support everyone brick by brick to be stable where he or she is, I really wanna have that kind of a community social interaction that is worldwide to all these people that are here. I want them to be big YouTubers to make more income, so that one day in life we can have a foundation that is worldwide. And if someone is in UK, he's running that foundation there. If Africa, we have someone in Kenya, Ghana, and Somali, we have that someone is running that foundation there. If we go to Asian countries, because I can see we have a long list of people that we interact daily and we support each other daily. So as we go on, we will remain with the same people that need that community and social empowerment. And you know, this is how the World Health Program started, WHO, by coming up with people that were of the same mind and they were thinking of medical betterness worldwide. So let's continue to pray for everyone. As people are celebrating 1K subscriber, let's continue to celebrate. Let's think of celebrating 1 million subscriber for one of us here one day. You get it? Let's think of celebrating to that. Let's think of bringing up a foundation in UK that supports, let's say, people that are autistic. Let's think of supporting people in Australia. We have a foundation there that is supporting widows that cannot have something in the table. Let's come to Africa and support kids that wants to be pilots. You get it? As we have that admins group, people take some things lightly, but the vision holders always take that vision at a higher level. Please make sure you put some smile on the faces when you are watching your content too. Uncle. Now, Uncle is telling us you put smiles when you are making some content. You are making me to laugh instead of smiling. Thank you, Dr. Benjamin. Great presentation. Thank you so much. Smile in the city as I end. So that was my vision, and I've just leaked it today, but let's keep pushing. If you have not liked, please like and share this. It's around 6:30. My time is up. Uncle is making people laugh. Uncle, they make smiles. We don't want gloomy faces. We don't want to have gloomy faces on camera. Also remember to deal with videos. Don't fake. Yes. Jangad is saying don't fake videos. You can see Betty C 1830 in the house. Insights. If you don't know how to smile, you go to, okay, bye for now, Dr. Ben Maikaka. Even me, I'm about to log off. It has been 2 hours of great time, my guys. So let's meet tomorrow for random questions. You know, Sunday we don't have a topic, it's random questions. Thank you a lot. Thank you. If you have not watched, start it from the beginning. Thank you. May God bless you. Let's meet tomorrow. If you have a question, Share Travels, you have that number. Don't forget to text me. And Junk 47 jhank47. My email address I've given you. Big up, everyone. Bye. See you, everyone. May God bless you. May you be blessed. Bye bye.